All right, Miss Mathis. My name's Casey. I'll be your licensed veterinary technician. I see this is Mr. Rebel. Hi, precious boy. You're so sweet. Look at you. Oh, you're a good boy. Oh my goodness. Is Rebel allowed to have treats with his visit?
Yes, but sometimes he does not eat them. He's a little too excited.
We'll keep that in mind for here in a little bit. We try to make him feel as comfortable as possible. Now, does Rebel have any potential triggers of concern with any type of environments where he may seem like he has slight anxiety?
Honestly, no. He's a very, very people-oriented person. He loves, the only thing he's kind of weird about is when we first walk into the vet, and if there's dogs that are roaming around or have a very long leash, he's very standoffish.
That's fair.
Them. But as far as people go and things like that, I've never really noticed anything.
That's good to know. That's good to know. So I'll keep that in mind. So he may have just a little bit of sensitivity with other dogs, especially if they're trying to be potential dominant individuals in the environment. That would explain why he's a little uncomfortable, because they would butt heads. Okay. So I see Mr. Rebel is here for his preventive care visit. So preventive care visits, the whole goal is to prevent issues from potentially taking place with their overall health, where we can prevent them. So we're going to talk about vaccinations, we're going to talk about some blood work, all types of good stuff. I see from his veterinary history, from his previous clinic, he's only been vaccinated for rabies. So we're going to talk about that and the benefits of different types of vaccines with his lifestyle and yours. Okay. So for starters, what type of food is Mr. Rebel currently on?
He is on a Hills diet, the Hills Science diet, age 1 to 6, chicken flavor, I believe.
1 to 6 years?
Yes, 1 to 6 years.
Just confirming. Okay.
Large breed, I don't know. Large breed.
Okay, that's good to know too. And about how many times per day is he fed and how much?
He's fed twice a day, morning and night, and he gets 2 cups each meal, along with boiled chicken.
Oh my goodness.
About a 1/4 cup each.
You get chicken. Now, is this boiled chicken without the seasonings or with seasonings?
Oh, no seasoning. No seasoning.
Good, that could be...
Just plain, bland.
That could be a potential complication for that seasoning. Yeah, just keep it bland and you're doing great. Has Mr. Rebel experienced any vomiting, diarrhea, coughing, sneezing that you may have concerns for? Okay. Do we have any history of allergies to medications or vaccines?
None that I've noticed, no.
Good.
He is a rescue, so he was 2 years old before, but I don't know if anything's before that, but since then, no.
When did you get him?
March of 2017.
Oh, so it's been a little bit.
Yeah.
Okay.
So I'm saying if he was, before that, I don't know if
Good.
he showed anything, but.
Good boy. Good boy. Okay. And we'll look at some of that good stuff as well. Would you currently have him on for flea and heartworm preventative if any is taking place?
He is on the ProStar. Is it ProStar? ProHeart. Excuse me. ProHeart.
The injection.
Yes, the injection for the year long.
ProHeart 12.
Yes.
Okay.
And we're lucky we don't have fleas in our house, so he's not on anything currently.
Good deal. As we go into summer, that may have to change, sweet boy. Potentially.
Yes.
If it does,
I'll call you guys and we'll figure something out at that point.
oh yes, because prescription products are best over the counter products. Are there benefits to either or? Technically speaking, yes. But we aim for gold standard in medicine to make them as comfortable and safe as possible. So prescription products tend to provide that coverage a lot better than over the counter. And we have a variety of oral and we have collar ones that are really good, that are long duration and topical. So you can choose what suits him best and you and your family best too. Is he currently on any medications?
No.
Good boy. Okay. Now with this overall type of visit, so seeing that he's been vaccinated for rabies is super important to have him vaccinated for. As you know, it's a neurological condition for humans and animals. It's referred to as zoonotic as a condition, meaning they can give it to us. We could potentially give it to them. In theory, it's not necessarily confirmed, but we can get it from them. It's considered a core vaccine. So core vaccines have to do with, no matter their lifestyle, it's going to be strongly recommended they have these vaccines because the potential for them to acquire those types of conditions is relatively high, whether they live inside or they live outside, whether they live inside and don't go outside ever to play, or they go outside to play with other dogs, different environments. So distemper parvo is also a core vaccine. Distemper parvo is a very serious two types of serious conditions they could acquire from different environmental settings. So like puppy Play dates, dog parks, boarding facilities potentially. The boarding facilities should have them vaccinated to be able to board there. Shelters. So distemper is a virus that really attacks their overall respiratory system, and it can attack their gastrointestinal system and be a neurological condition. There's no cure for it. If they survive it, it's relatively uncommon, but it can happen. They have unique side effects as a result if they survive.
For their life.
They have unique types of neurological deficits, but they can still live a great life. But we still don't want to potentially have them acquire that condition. It's very hard on them, and it's not that inexpensive to treat. But it's very inexpensive to prevent. So we need to look at getting him vaccinated for his distemper condition, if you're open to that, as well as parvo. So the parvo virus is a very serious condition we see primarily in puppies, but adult dogs can get it too. And it attacks their gastrointestinal system, and it basically attacks their small intestine to where it breaks into pieces, and it comes out in their feces, and it's highly contagious. This virus can live in the environment for about over a year. The mortality rate with animals that have parvovirus is very, very high. There's no treatment for it besides supportive care. So having them hospitalized, it can be very expensive as well, but also inexpensive to prevent. And huge plus, our distemper parvo vaccine is a combination 1 injection, and it's recommended for all of them. So we can look at doing those 2 core vaccines if you would like to go ahead and get that situated for him. Mr. Red Bull. Now, we do have non-core vaccines dependent on his lifestyle. So does Rebel like to go swimming in lakes or play outside? Does he like to go on trail walks, trail runs?
No to the swimming. He does not love water at all. Baths are a challenge. He does play outside in our huge backyard with our other dogs. We do occasionally take them on walks around the neighborhood, so I really don't go into any wooded areas. But what kind of vaccines is that for that? If I do decide to, take him on a camping trip or something.
Oh, definitely. If you take him on a camping trip, there's a few things we need to look at, especially dependent where you go. So geographically speaking, northern U.S., southern, doesn't matter, east, west, all of it, there's different types of vaccines that can strongly benefit him. Leptospirosis is one of the big ones. So leptospirosis is a bacteria that's primarily found in rodent urine. And so like raccoons, for example, they pick up this bacteria in unique ways in the environment. If they acquire it, they can spread it in their urine. So if they urinate nearby, say if Rebel did feel like he wanted to go jump in some lake for some funsies on a camping trip, then he could acquire that potential bacteria from the rodent urine that went into the river. If they urinated near it, or if it started raining and the animal urinated nearby, it'll hang out in the river or the water for quite some time. They can get it through ingesting it. They can acquire it if they have like a little scratch on them somewhere in their paw or wherever. It can get into that wound, and it can cause complications for them. So we see leptospirosis, potentially it causes a lot of kidney complications. So it's very easy to prevent, but overall it's inexpensive too. If you have to treat them for leptospirosis, there's not a test to confirm that condition. There's only overall symptom observations and of different types, and we do a lot of blood work to look at organ function. So primarily it'll focus on the kidneys, and it can cause kidney failure if it's too progressive. So if it's found early stages, a lot of times it can be potentially treatable. Every animal's different, but we don't want it to get there if we can easily prevent it with a vaccine. So if it suits the lifestyle, if they're camping, we're going to recommend it. It's considered a non-core vaccine because it has to suit that lifestyle to really be needed.
Gotcha. Okay.
Lyme disease is another type of condition that humans can get.
Yes.
Animals can get too. Leptospirosis, the one we just mentioned, humans can get that as well from animals. So if Rebel potentially had leptospirosis, he could give it to you, vice versa.
Wow.
And it will cause kidney complications in humans also. Now, Lyme disease is a little bit different. So the Lyme disease in
Never
humans,
knew that.
Yeah, I'm telling you, there's always something new, right? Every day is a new day.
Yeah.
With Lyme disease, it's very much the same in humans. They get it from a specific deer tick. He has a very unique scientific name. He's called Izates scapularis. He's also known as the black-legged tick. So you may know him as deer tick or black-legged tick. He has many names. He's very, very bad.
Yeah.
He transmits a special type of bacteria associated with being a Lyme disease complication. It causes a lot of joint swelling, so you have presentations like arthritis, and overall you could tell they're just out of their normal vibe. They're not doing the same as they normally are. They're eating less than normal. They are a little bit lethargic, especially if they're having joint swelling. They're not going to want to play as much. If he's not on tick preventative, that can be something we also look at, dependent on his lifestyle. But we don't want him to potentially get Lyme disease if you're going to be in areas that are wooded, or you live next to a wooded area where the ticks can easily get into your yard. So you may not have seen ticks. That's fantastic. I live by some woods. I haven't seen ticks where I live, but the chance is there, especially if he goes on camping trips.
Okay.
So we need to look at tick prevention potentially, and vaccinating him for Lyme disease if you're interested in that with his lifestyle.
Okay. The Pro Heart doesn't do. There's a particular preventative for ticks only, or is that one do everything?
So Pro Heart 12, it only does heartworm preventative, and it will prevent against hookworms at that moment.
Okay.
It will help eradicate them if they're within the system.
I gotcha.
So hookworms are a unique type of intestinal parasite. They're relatively common for puppies and adult dogs.
Okay.
They can cause some serious problems. If they have a hookworm infestation, they can actually cause fatalities through different types of anemia, so blood loss, because that particular parasite drinks blood from the small intestinal tract of the pets. And it's something we can get too. So Pro Heart does a fantastic job of preventing everything it does. Ticks is a little different. There's not one primary product out there that prevents everything combination at once. You kind of have to do like a burger fry combination and have two that work together simultaneously.
Gotcha.
So we have very good prescription preventatives that will do flea and tick. If the fleas become a concern for you in the summer, we can also knock it out with some tick prevention. It's called Preventative. You can give it once every 3 months.
Wonderful.
Instead of every month, so it's a huge plus. And we have some others as well. With him, before he can be on any additional heartworm prevention, when his Pro Heart 12 injection is going to be due again, we do have an annual blood test that's performed. It's called a heartworm test to check in for heartworm conditions. And ours actually is a combination heartworm test, which is really cool. It will check for Lyme disease too.
Oh, nice. Wonderful.
So it's pretty awesome. So if he ever came in contact with it and he showed he was positive for Lyme disease, we could observe that. There are treatment methods for Lyme disease. It's relatively simple for them.
Okay, wonderful.
Huh, Rebel? Would you like to come to the treatment area with me? So I'm going to go ahead and borrow Mr. Rebel. I'm going to take him to our treatment area. This is where I'm going to get his vitals, so his heart rate, respiratory rate, his body temperature, and of course overall blood samples for his organ function test that we know he's due for today, to check for his kidneys and his liver and a bunch of other organs to make sure they're functioning right.
Okay.
And a complete blood count. So same as humans get. This will check his red blood cells, white blood cells, platelets, and some other good stuff in his blood to make sure that his blood is healthy as it should be for his species. Does that sound okay?
Sounds good.
All right. Mr. Rebel and Mom said you can have some treats. You want treat? You want treat? We can go get a treat in the treatment area. Pun intended.
Okay,
Let's go. Come on, Rebel. Let's go. Come on. We'll be right back.